April is esophageal cancer month, spotlighting a type of cancer that has been on the rise for decades. To tell us more about the risk factors and signs we should be on the lookout for, we are joined by Baylor Scott and White's Dr. Vanna Konda. Dr. Konda, thank you so much for joining us today. So let's start off first. What causes esophageal cancer?
Esophageal cancer is in two forms. One is esophageal adenocarcinoma, and the other is esophageal squamous cell carcinoma. Esophageal adenocarcinoma is caused by gastroesophageal reflux disease. After years of injury and inflammation that occur to the esophagus, it can sometimes heal not like the normal lining, but instead like Barrett's esophagus, which is a precursor condition for esophageal adenocarcinoma.
What are the signs and symptoms to be aware of?
Signs and symptoms that are of concern include trouble swallowing or food getting caught or stuck, weight loss, vomiting up blood, or pain with swallowing. If you have these signs, you should talk to your doctor about getting your esophagus checked.
Who is most at risk and when should you be screened?
We have several risk factors that we know are associated with esophageal cancer. They include gastroesophageal reflux disease, and that is both symptoms that occur over years, frequently throughout the week, as well as the need to take daily acid suppression medicine to control symptoms, as well as male gender, age older than 50, Caucasian race, hiatal hernia, obesity, cigarette smoking, and family history. If you have multiple of these risk factors, you may want to talk to your doctor about getting screened. This can be done with a screening endoscopy, where a lighted camera is done during a sedated procedure to check your esophagus and stomach.
Can esophageal cancer be treated and/or prevented?
The treatment for esophageal cancer depends on the stage. Common treatments include esophageal surgery, chemotherapy, and radiation therapy. In addition, when we can find esophageal cancer at early stages where it's limited to the superficial lining or precancerous changes in the setting of Barrett's esophagus, we can actually perform treatment through the scope to cure or prevent esophageal cancer.
Dr. Konda, thank you so much for joining us and educating us today.
Thank you.